Hello, welcome to a iStent fail and rescue video. I'm going to show a couple different styles. This is a G1 device that I was placing, and I thought I had it in a good position. Sorry, the video is a little off. It's not easy getting the view of everything and putting it on camera. You can see I'm taking out the viscoelastic, and I realized that is just not where it needs to be. It's way too anterior in trabecular meshwork, so mag up a little bit and go in. And this is the exact same technique you do to rescue G1 iStents anywhere. I do this all the time. Grab them from wherever they are, and then place them where they belong. And that's nicely in the canal there. We did a little ski technique to slide it into the canal. And there you can see it's well positioned. There's also a hydrus that's already in there. That was put in about 6 months prior. I commonly do the combination. Look at the reflex there. You can see the hydrus and the G1 iStent. Real nice reflex. Moving on to iStent inject. I would love to tell you that all of my injects look just like that. Beautiful. Just little anterior to scleral spur and beautiful reflex at the end. Look at that. That's exactly what I like to see. But here's a case where the patient was exceptionally anxious. I managed to get the first stent in very, very well. And then I don't know what happened. I thought I was in the right spot, but there is clearly not where it's supposed to be. It is posterior to scleral spur, and you can see there's no reflex there at all. You can clearly see the canal anterior to the stent. So what do? Go in and grab the stent. These remove very easily with little MST microforceps. I had the original thought of rethreading it while it was in the canal there. It made sense to me at the time, so here's my first attempt. And this was a total fail. This is really hard to do, way harder than I anticipated. So I gave up and just removed it from the eye. You'll see, give it a little bit of a try, but that just wasn't going to happen. So we take it out, and then I put it on the cornea. Made the mistake of touching it with a WEC, and it does a nice job of hiding in the little crevices of the WEC, but I managed to find it and get it isolated onto the cornea. And that's really where you want it. Just put it in the viscoelastic, and then you can easily rethread it. This is not a problem at all once you get it oriented. It's very important to kind of fidget with it a little bit to get the orientation correct. And just like this, and then you'll see once I get it where it wants to be, then it goes right in, no problem. I kind of tap it down a little bit, and then we're going to put the sheath back up into the enclosed position so I can get it back in the eye. And this time I am much more careful about putting my trocar just anterior to scleral spur. A little bit of an indent, pop, and there's the reflex that I was looking for in the first place. So very important. If you don't have the right position, just grab it and put it where it belongs. Here you can see both stents are in really nice position now. And the reflex is there. It's not super obvious like that other case, but it isn't always. Here's a nice before and after shot. There's the one on the left, which is wrong, and there's the repositioned one on the right. So just a couple cases of iStent fail and rescue. Thank you very much for your attention.